What's your view on this sort of quantified self? Do you think that
Yeah.
overdoing it is something that will create problems in itself, or do you
So,
think it's just...
so the quantified self, I think, it's gone through a bit of a dip in its credibility in the last couple of years. So we had the Fitbit revolution, and that's tailed off a little bit, mainly because the data, the information that comes out of Fitbits and like actually isn't that useful. Knowing that you're supposed to do 10,000 steps in a day is, it's a data point, but it doesn't really give you any depth of understanding of how you feel as a result of whether that actually is the right amount of walking that is going to improve your lifestyle, your mood, your outcomes, etc. We need AI to really better understand the human condition and provide recommendations back to the individual based on much more data, much more detail. And I think the quantified self is going to come back in a huge way. And I think it might actually be one of the major changes in the way that we deliver medicine in the future. Personalized medicine, I think you said that yourself just a minute ago, that being able to understand the individual and what they need in order to make them better, rather than just applying a one size fits all solution to the population. It's actually the only way to behave. Either we give the same drug to 10 million people, or we have a GP, a general practitioner, a doctor who can understand in detail the health state of every person. And we can't afford it,
No,
both of us live in London. It's a nightmare trying to see a doctor these days. It's just really, really hard. We need to have healthcare at home. We need to understand the person. We need the quantified self, and we need the AI from that drives results.
Yeah. But what's interesting also is that behavioral change is very difficult. We know that, yeah?
Always.
And as we know, it's also emotional triggered. So I gave this morning the example of this neuroscientist that has studied behavioral change and what triggers decisions, and worked on people who had parts of their brain which were responsible for emotions altered or damaged. And those people were able to describe logistically what is a process of decision, but they couldn't take decisions. Yeah. So it's a really an emotional aspect of it. But what I feel is that because of that, we need technologies that don't add any point of friction in our life.
Yeah.
So if you can do that sort of stuff while I'm doing my day-to-day life, yeah, then the chances of success of measuring and of getting some sort of information and taking decisions based on that sort of information are much higher. And I come from the world where VR is actually a technology that involves a lot of points of friction. Yeah? I think it's great as a technology, but you have to put a headset on. You're like a deep side diver when you go into a VR.
Absolutely.
Stuff.
I guess that's the promise that augmented reality holds out for us. That over time it might deliver down into a system that you would be willing and in fact desire to wear all the time, and that it could become part of our everyday life, and that we can take the friction away from that interaction with technology.
Yeah,
it's a fantastic future, certainly.
Which I think it's extremely important. Try to do things while you're not doing them almost.
Yeah, it's a key underpinning of my strategy in the business that I run, MTech, in that we're building technologies to read expression and emotion from the face of the individual using glasses, and I'm building it specifically with the view that these technologies will one day be inside augmented reality, so that our digital assistants, our AI presentation, our interactions with other people can be informed by the emotion that we're naturalistically expressing. And some of the work that we're starting to do now with Inition in virtual reality is a really great taste of where that can go. I think that VR and AR obviously have very different use cases.
Totally, yeah.
And that empathy, that interaction that you get in VR through the immersion is very powerful all by itself in providing healthcare benefits then.
Yes, absolutely. And, we're doing some work with, in the sort of social enterprise world. So we're working with a social enterprise in London which deals with training in the fostering and adoption. And, we've done some VR training which looks at how trying to get potential parents who will adopt, to try to understand what those kids are going through. Yeah? So it's a shift of paradigm. It's trying to move people into the paradigm of the child from the womb.
So you're putting the parent in the child's
in the
shoes.
child, and the whole experience starts in the womb. So
wow.
the child listening to noises and violence and all of those things outside, and that has a profound implication on their future life.
Fantastic.
But the other thing is that those kids who have been traumatized, sometimes they don't want to talk to an adult. So very often we are asked to see, to be part of some research which looks at how those kids can talk to their pet or to an avatar.
their pet?
Yeah. And, can we actually use this sort of emotional systems to make that avatar emotional also? Because that would be a very interesting,
that's brilliant.
way of looking.
There's a corollary, a project that we've just started doing with leading autism researcher in the UK, which is looking at whether you can desensitize autistic teenagers from the stress of interacting with strangers, which is it's a big issue for some people on the autistic spectrum, by introducing them to avatars of where the avatar is completely unknown to them, and measuring their emotional response in communicating with that avatar. The idea is that the avatar will be driven by a trusted individual, their mum or dad or whatever, through another headset. The teenager in question is seeing a stranger, so a safe environment, stressful situation, and desensitizing that interaction. So very similar in terms of that, getting people into a situation that otherwise they just would never be able to get into without that.
And that's very interesting, because you probably know that virtual reality has been used with autism and trying to look at getting the other people to understand what autistic people or autistic kids goes through. That sort of non-linear world, which VR finds a very good application to, and it's getting the other people to understand so they can adapt the way they communicate with those people. That's why it's not only an empathy machine, but it's a communication. It's a different type of communication. It allows us to not just be simple, paradigm bubbles walking along, in tiny little words, but to understand the paradigm bubbles of the other people.